today. Um, as with other things that we've done, I like starting with trying to understand how it works so that we can, you know, understand what might be happening in our body a little bit more. The thyroid's a really cool hormone, and I'm sure it's something that you guys have, gotten tested at the doctor's office and you've seen some of these things before. So it's cool because its control starts all the way up at the brain. So in the hypothalamus, we get this thing called thyrotropin releasing hormone, which then goes on and tells our pituitary gland a little bit lower down to create this thing called thyroid stimulating hormone, which is exactly what it sounds like. It stimulates the thyroid to make thyroid hormones. So pretty simple there, right? Then our thyroid gland is able to make T3 and T4, which are the tried and true thyroid hormones, which then can travel to our target tissues and impact metabolism. Some caveats here is most of what our thyroid makes is T4. And T4 is not active and it doesn't influence the metabolism to increase how much we're burning in any way. So it has to be converted into T3 first. An easy thing about these hormones is T4 is essentially it has four iodines attached to it. T3 only has three iodines attached to it. So we have to remove one of those iodines for it to work in our body and with the cells. Who's seen this when they get their labs done? TSH, T3, T4.
I
Yep.
do.
Everyone's seen those, okay? So what this means, just so we're, understand those values a little bit more, is when TSH is higher, that means that we're having to send this signal to our thyroid to make hormone, make hormone, make hormone, which means that there's some resistance going on. Similar to how we talked about insulin resistance, where the cells stop listening to the insulin and that then more insulin has to be produced, more insulin has to be produced for our cells to respond. It's kind of a similar thing here. So when we see TSH being high in our labs, that's more indicative of like a sluggish thyroid, right? Now, that's not the whole picture. I know a lot of you are Dr. Jackie Fields is my mom's patients, which she certainly will run the gamut of these tests. But if you have a different doctor that's running these tests, a lot of times they'll just test this TSH right here. And it just doesn't give us that full picture because maybe the TSH is fine, but maybe down here at the tissues, we have all this T4 that isn't getting created into T3, and the cells aren't able to actually use this metabolically active hormone. So that's kind of the big picture overview of how thyroid hormones work. Um, Now, if we get into like the tissues and how it actually impacts how we store fat and our weight, essentially, there's some things going on there too. So, right, just like back here, T3 and T4 will go to pretty much every tissue, every cell in the body can respond to these hormones, which is really cool. So if we look at what happens yeah, go for it, Katie.
Um, so when you are getting tested,
Hmm.
what should you make sure that you're getting tested for besides the TSH, the
Yeah,
T3 and T4?
T3 and T4. Yep.
Okay, so those
Yep.
three.
Those three, and we'll talk more about what labs to ask for and push for.
Okay,
I have a whole slide on that
okay.
because it can get even more complicated and confusing. And as I'm sure a lot of you know, right, like in going into your doctor's office these days, you have to be a huge advocate for yourself and making sure you get what you need and what you deserve. So I'll give you that list of what you'd want to ask for. But yes, that's exactly it. And I think understanding this of like, oh, it makes sense that if I just do my TSH, that's not going to give me the full picture because maybe I'm doing something down here at the target tissues and my metabolism is still impacted, even though, quote, someone tells me your labs are normal, right? Which is classic and frustrating, especially if you're like, well, I don't feel normal, or I feel more fatigued, or more lethargic than normal, or putting on more weight than normal. This is the behind the scenes of that. Great question. Any other questions? Because this is confusing. Okay, cool. If you have any, just unmute yourself and yell at me. I love it. So in our fat tissue or adipose tissue, thyroid hormones will increase this thing called lipolysis, which if we break that word down, it just means breaking down fat. Lipolysis, breaking down fat. We had talked about in previous, that first class where we talked about insulin. When insulin is really high, that's a hormone that tells us to grow and store. And so we don't get a lot of lipolysis. So thyroid hormone kind of goes hand in hand with insulin. If insulin's really high, thyroid hormone might get blunted, and then we're not able to break apart our fat and utilize it for energy. So it's really important to have, robust thyroid function, I guess, so that we're able to utilize our fat in our body and not just be in this constant state of storage. So that's what this guy is here, this lipolysis. Um, it's also helpful for helping our liver to break down stored nutrients so that we can help to stabilize our blood sugar. So a lot of this comes down to blood sugar stabilization too, like we've kind of talked about. The other really cool thing that thyroid hormone does at a different tissue is our muscle tissue. So we've talked about this a little bit when I mentioned the importance of resistance training and building and holding on to muscle, because muscle acts like a sponge for glucose. So if we have more muscle mass on us, then when we eat food that might have sugar or carbohydrates in them, we're going to have less of a blood sugar spike after that meal with more muscle because our muscle is able to soak up that sugar. So just think of muscle as like a sponge for sugar. Obviously for other reasons like, you know, maintaining functional status as we age and those kinds of things, having muscle is important, but it's also important for there's Judy. I knew she was coming. Hey, Judy. Oh, I don't know where she is. She's in here somewhere. Hey, Judy. We just got started, but I'll make sure to send you the recording so you can watch the first few minutes of this too. Okay, so that's kind of, on the tissue level, how it's maybe impacting weight. So bigger overview here. Um, right? This overall thyroid hormone is going to control our metabolic rate since our cells can respond to thyroid hormones. And then those underlying thyroid issues, or if it's sluggish, like we talked about, that can make fat loss difficult because we're not able to do the process of lipolysis and breaking down fat and using it for energy. And then we're also struggling with maybe insulin resistance and just overall slowing of the metabolism. This is just a picture I put in there of like, I think sometimes it's confusing of like, how does a hormone do this? How does it work? How does it influence our metabolic rate? And really, again, at like every cell, this T3 can go to the cell, can bind, can go in, can release a bunch of signals inside the cell, and then eventually, it essentially is going to the DNA and influencing what kind of proteins and things we're making in our body to control our metabolic rate to increase how much we're burning, which is pretty cool. So the conundrum here, though, with when we're talking about weight loss and we're talking about optimizing thyroid hormones, is there's going to be a balance. So in the first class, we talked about how, okay, if we are not eating enough, right? If we have restricted how much we're eating for too long, we're eventually going to slow our metabolism. So I had showed you guys just with my hands, I guess, of we're here, we want to lose weight, we start eating a little bit less, we lose weight successfully, and then we plateau and we're like, what's going on? I'm eating so little, I should be losing weight. But what we forget is happening is our metabolism is adjusting to our new intake. Thyroid hormones is responsible partly for those changes and those adaptations of why our body is so smart. So we want to think about that when we're making these changes. This is why, like all the changes that we talked about last time, are really focused